occurs keratometric and pachymetric changes post microLASIK, femtoLASIK and SMILE in Indian population. Dr. Himani Chatterjee.
A very good morning, everyone. So I'm here to present a study on the corneal curvature and pachymetry changes in patients undergoing microLASIK versus femtoLASIK versus SMILE in an Indian population. So why did we do this study was because this is an unpublished data in Indian population. There is only a single study done in the Chinese population which compares the SMILE and the femtoLASIK corneal curvature and pachymetry. But as we know, there are ethnic variations in the Chinese and Indian eyes with respect to corneal keratometric power, pachymetry, and the anterior chamber depth. And also, there is no such data which compares all three procedures. So the objectives were to compare the corneal curvature and pachymetry changes post microLASIK, femtoLASIK, and SMILE in myopia and myopic astigmatism, and to see the stability of these parameters in the post-operative period. So we designed a retrospective observational study and included those who had undergone these procedures for myopia and myopic astigmatism and had a post-procedure visual acuity of 6/9 or better, and excluded those who had lost to follow-up. So patients fulfilling this criteria, out of them, 50 eyes had undergone microLASIK, 65 eyes had undergone femtoLASIK, and 67 eyes had undergone SMILE. So we reviewed their old records and we evaluated the best corrected visual acuity, spherical equivalent, corneal curvature, pachymetry, and Schirmer's test and TBUT on the baseline preoperative days, post-operative day 1 month, and 3 months. So this is an example of how we evaluated the old records of the patient in a microLASIK patient up to 3 months. So the baseline parameters were all non-significant except for the spherical equivalent, which was significant. The BCVA was non-significant. The change in BCVA was non-significant in all the cases, and SMILE, which is shown with the gray graph, shows a stable refractive outcome. In terms of average K, there was significant reduction in average K in all the procedures, but SMILE showed a slight increase in average K at 3 months, which was statistically not significant. The change in keratometry with respect to spherical equivalent was statistically significant in all the procedures, but SMILE shows a comparatively stable delta K by spherical equivalent. Pachymetry reduction was seen in all the cases significantly, but femtoLASIK, which is shown by the orange graph, shows a slight re-thickening at 3 months. The Schirmer's test was significantly reduced in all the cases, but microLASIK shows the highest reduction in Schirmer's as compared to SMILE, which shows the least reduction. So male predominance was seen in microkeratome LASIK in our study, and female predominance was seen in femtoLASIK and SMILE. And similar findings are seen in femto and SMILE group in the Chinese population too. SMILE shows a greater reduction in average K from the baseline in contrast to Chinese population. But this may be due to the significant difference in the spherical equivalent in our study. SMILE shows a lesser delta K by spherical equivalent, which is suggestive of a stable corneal curvature post-operatively. Similar reports seen by the Chinese population. There was an increase in average K at 3 months post-operatively in SMILE in our study, in contrast to the Chinese population, but this was not seen. But the difference between 1 and 3 months is not statistically significant. Pachymetry reduction was highest in SMILE, which is in accordance to the study done by the Chinese population, but corneal remodeling was stable in SMILE after 1 month. The Schirmer's test was least in microLASIK group, and similar reports are seen by Ganesh et al. So to conclude, the corneal curvature and pachymetry are not stable in the early post-operative period, and SMILE is more stable as compared to microLASIK and femtoLASIK in terms of stability of corneal curvature, pachymetry, and BCVA in our study of 3 months. And microLASIK has higher chance of developing dry eye disease. So this study provides valuable insights into the effects of different refractive procedures on corneal structure and stability in an Indian population. And future studies with larger sample sizes and longer follow-up periods could further elucidate these findings. So the limitations were this was not a prospective and randomized controlled study, and this was a single center study with a small sample size, and only 3-month follow-up data was there with us. Thank you. Yes, ma'am. For the microLASIK group, for 3 months, it continues to be at almost 12 millimeters. And in SMILE, it continues to be at around 16 millimeters, 15 to 16.
This is by Sharma's.
By Shermas.
That's become a very redundant way of looking at the dry eye.
Yes, ma'am. We should also consider other parameters as T-bar and.
What about epithelial thickness? Did you study?
Yes, ma'am. Yes, sir. Actually, we saw a slight increase in the epithelial thickness in the femtolasic group. But as studies show, there is slight epithelial rethickening in of 10, 10 to 15 microns in after femtolasic. There is literature which shows this.
I think
So-
now the trend is to go for epithelial thickness in all cases.
Yes, sir. Yes, sir.
So, see, my plea, because you guys are younger, and my plea is when you're making a free paper, try to be more comprehensive, because these are very simple facts which are already there, so try and get something extra. And 3 months, of course, we understand is not a long term.
Yes,
so
ma'am.
obviously you've also put it as a limitation. But if we are, because it becomes, every study is also becoming machine skewed basis. All said and done, what we read, even in the best of journal and publications, is not a very, not all of them are very
Proper, yeah.
honest
True.
and proper. So we would love to have like a comprehensive data which is actually genuine. So if we are talking about dry eye, you may not pick up anything else, but just dry eye between 3 machines, because not many centers have all 3 machines,
Yes.
and just study that in detail and have a little longer follow-up. So that makes it more enriching, and actually then there is a take-home message and there's more authenticity.
Yes, ma'am.
to
Actually,
what
we
you've
are
done.
doing a prospective study right now, and we have a data of 6 months. So we are actually going for the statistical analysis. So not only dry eye, we have seen a lot other parameters which are going to change, which is not in accordance with the studies already done.
Yeah,
So we are very soon going to publish it, ma'am.
perfect. Sounds good.
Thank you, ma'am.